Alright, come on in. How are you?
Good, how are you?
Good. I'm gonna shut this curtain for some privacy. My name's Lauren, I'll be your nurse. Can I have your name and date of birth?
Allison DiCarlo, 6/1995.
Okay, great. And why are you here today?
I'm here for checkup.
Okay, do you know where you are?
Yes, in the hospital.
And do you know what day it is?
It is Friday,
And do you know what year it is?
2018.
Okay, great. Patient is AO times 3. Have you had any thoughts of suicide or any depression lately?
No.
Okay, do you have a preferred language? English is
Yes.
okay? Okay. And do you have any cultural beliefs that I need to be aware about?
No.
Okay, and out of 10, from 0 to 10, what is your pain?
0.
0? Okay. I'm going to do your vital signs. Blood pressure is 120/80. Respirations are 16. Pulse ox is 100%. Pulse is 80. And temperature is 98.6. When I saw you walk in, your gait is steady, your posture is erect, your mood and affect are appropriate for the conversation we're having. You're engaged in conversation. You have no mobility aids. You're dressed appropriately for the weather. And your age is what you have stated. I'm going to do some neurological assessments on you, but I'm going to ask you a few questions first. Do you have any family history or history of your own of hypertension,
No.
diabetes,
No.
cardiovascular disease?
No.
How about any respiratory issues?
No.
Okay. Do you smoke?
No.
Does anybody in your house smoke?
No.
Okay, great. So for the first thing I'm going to have you do is I'm going to have you smell. So if you just cover one nostril for me and sniff.
Lavender.
Lavender, and then this one.
Lemon.
Okay, perfect. Cover the other one. Smell.
Lavender.
Okay.
Lemon.
Okay, great. Do you have any problems smelling that or anything?
No.
Okay, can you just do one more time with anything? 1, 2, okay. I'm just gonna look up. Okay. Patient is able to identify both smells. Bilateral nares are intact. Nasal mucosa is dark pink and smooth. I'm gonna check your ears. Do you have any ringing in your ears? Any problems hearing?
No.
Okay, can you just cover one ear for me? And repeat what I say.
I love Christmas.
Other one.
I love Thanksgiving.
Okay, patient's hearing is intact and there's no discharge from their ears. There's also no discharge from your nose. You ever get any nosebleeds?
No.
No, and you never have any discharge from your nose or ears?
No.
Okay, and as I said, no discharge and from ears or nose. I'm going to test your eyes. If you could just do me a favor and read the last line on this for me.
FEZOLGFTD.
Okay, and do you wear any glasses or contacts?
No.
Okay, patient has 20/20 vision. I need you to look right at me. Okay. Follow this with just your eyes, don't move your head. Okay, and look behind me, and then just follow the pen. Perfect. Okay, so patient's pupils are equal, round, and reactive to light and accommodation. EUM is intact. There's a discharge coming from the eyes. Do you ever have any problems seeing, any blurry, dizziness?
No.
Okay, great. Okay, so next I'm going to, if you wouldn't mind just taking a sip of water for me. All right, any difficulty swallowing that?
No.
Okay, so patient has no difficulty swallowing, trachea is midline. So I'm gonna have you stick your tongue out and say ah. Okay, and then just open your mouth for me. Okay. So soft palate rises, uvula is midline, lips are moist and pink. There's no missing, broken, or loose teeth. The oral mucosa is dark pink and moistened. Also the nasal mucosa is dark pink and smooth. If you could just stick your tongue out for me, okay, and to this side, and then say light, tight, dynamite.
Light, tight, dynamite.
Okay, so patient had no difficulty articulating that. Tongue is midline and good with the movements. Okay. So next I'm going to, if you could just look up over here for me. Okay. No JVD noted. I'm going to do some pulses. Carotid pulse +2 bilateral. If you could just move your head this way. Okay, push against it, okay? Shoulders up, down, up, down. Okay, so left and right neck movement is bilateral and equal in muscle strength, and also the shoulders are bilateral and equal in muscle strength. If you could just put on your eyelids for me. Okay, conjunctiva is pink and sclera is white. If you could smile for me, and then frown, and then puff your cheeks out, and raise your eyebrows. All facial symmetry is present and intact. I'm also going to, every time you feel me touch this in your face, just say now.
No. 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 No.
Okay, facial symmetry and sensation is intact. Okay, do you ever have any issues breathing, any shortness of breath?
No.
With rest, with activity?
Nope.
Okay. You ever take any do you take any medications for your heart?
No.
And you have no hypertension?
No.
Okay. Okay, I'm gonna take a listen. Every time I move this, can you just take a deep breath? Okay, now I'm going to check your heart. Aortic, pulmonic, herbs, tricuspid, mitral. I'm going to check for murmurs. If you could just stand up for me.
Sure.
I'm going to test your down, so if you could just shut your eyes with your hands down at your side. Don't move. Okay, perfect. If you could just turn around and face the back. I'm going to check some breath sounds. Every time I move my stethoscope, you just take a deep breath. Okay. You could just stand there for 1 second. Okay. Shoulders and waist are an equal height. Normal S curve of the spine. Spine is also aligned. No lordosis, kyphosis, or scoliosis noted. If you could just take a deep breath for me. Okay. Equal diaphragmatic expansion. Also equal chest expansion. AP diameter is half of the transverse diameter. All auscultated breath sounds are heard. There's a steady rhythm of breath sounds, and they're all equal. Okay, you can sit back down for me. Normal S1, S2 noted, no murmurs noted. Equal, clear breath sounds noted in all auscultated areas. Okay. Do you ever have any tingling or numbness in your body?
No.
Anything like that?
No.
Okay. Do you have any muscular issues? Any pain while you're walking? Any change in temperatures in your legs? Do you have any swelling or edema in your legs or
No.
arms? Okay. So I'm gonna just put your arms out for me and your legs. Okay. No edema noted. Temperature is warm and dry. Skin is warm and dry. No edema noted. I'm gonna check for capillary refill. Capillary refill is less than +2. I'm also gonna check these up here. Capillary refill is less than 2. There is normal skin color throughout the body. No parasites, no lesions, no swelling of any kind throughout the body. I'm gonna check for skin turgor. Okay, skin bounces right back, skin has good elasticity. Hair is even throughout the head and clean. Hygiene is also clean, no smell. Patient is very good with her hygiene. There's good skin color throughout the whole body, and also good hair distribution throughout the whole body. So we're going to test your range of motion. So put your arms behind your head down behind your back, out, up, down. Put your hands out, arms out again. Put your wrists up and down, and then put your hands over and back up. Okay. So put your one leg, pull that up, down, kick your leg out, down, and move your foot up and down. And same with the other leg. Knee, up, leg out, foot. Awesome. Do you have any problem with that? Any pain?
No.
Tenderness?
No.
Okay. So now we're gonna do it against my resistance. So you can just put your arms out like this, pull in, okay, pull back, okay, push your hands up against mine, and down, down, thank you, and then up, and then back, up, down, push, pull, push, pull, push, pull, push. Also routine at the same time, up, down, and then squeeze my fingers. Okay, so equal muscle strength in all muscles and joints. Range of motion is intact 5 out of 5 with and without resistance. Okay, I'm also going to check pulses. Check your carotid one more time. Carotid +2 bilateral, +2 bilateral, +2 bilateral, +2 bilateral, +2 bilateral, +2 bilateral. All pulses palpated are +2 and bilateral. Okay. All right. So have you had any problems urinating or making a bowel movement?
No.
Does it burn when you urinate?
No.
Any pain?
No.
When was your last bowel movement?
Yesterday.
Okay, and what was it, formed or watery?
It was formed.
Formed, and what color was it?
Brown.
And what color has your urine been lately?
Light yellow.
Okay. Do you know when you're gonna make a bowel movement or
Yes.
go to the bathroom? Okay.
Mhm.
Also, muscles are not breaking down or having any atrophy. Okay. Do you have any pain or tenderness in your abdomen at any time?
No.
And you said you have no problem. You have any history of GI or GU issues? No family history of any diseases? Okay. So if you could just lay back for me. And just let me know if you have any tenderness. I'm just going to take a listen real quick. Equal bowel sounds heard throughout the 4 quadrants. And let me know if you feel any pain. No pain, right? Okay,
No.
so no pain and tenderness throughout the abdomen. I'm going to palpate your, try to see if I can feel your bladder. I cannot palpate the bladder, which is normal. There's also no catheters or drains or any GI or GU devices. The patient's stomach is flat with contour, with no contour. The umbilicus is midline. There's also no lumps or deformities. No lesions throughout the body. No lumps, deformities. Okay, if you could just stand up for me. I'm sorry, sit back up. Okay. And I'm just gonna do a quick look of you. AP diameters, got the transverse diameter, equal chest expansion and diaphragmatic expansion, hair's clean. Alright, I think I'm done.